Thank you for coming to this press briefing. We have Dr. Chong Chok Kwan, Head of Communicable Disease Branch of the Center for Health Protection, Dr. Lau Ka-heng, Chief Manager of the Hospital Authority. First, Dr. Chong will give us an update on cases. Thank you. Yesterday, there are 360 PCR positive cases, 54 from the Hospital Authority, 17 from the Public Health Laboratory of the Department of Health, and 289 cases identified by private contract testing laboratories. As for RAT positive cases declared online, 360 yesterday. So today, in total, there are 851 positive cases. So far, we have 1.2057 million positive cases. Today, 74 are imported cases, 30 identified at the airport. 25 of the cases arrived in Hong Kong on the 10th of June on 12 flights. 5 cases involved arrivals on the 9th of June involving 3 flights. And then 31 cases were identified at quarantine hotels. For 13 cases, the cases identified after 7 days. Most of these cases have high CT value. Individual patients were aware of their own infection history. And then for 2 to 3 cases, the CT value was very high. These are probably local infection cases, and we will send these cases for genetic analysis. For residential care homes for the elderly, there are 2 staff members who have confirmed cases from 2 homes, and 27 elderly residents need to be quarantined. For schools, well, then it's not a school day today, but then there is update on figures. For the Po Leung Kok Leung Man Chan English Primary School, Class 4B, there's an additional case, so in total 4 cases. Class 6A, 6 cases in total. One of the teachers taught classes at Class 6A, and he also the teacher also taught a class for Class 5A, and there are 2 more cases. So in total, there are 13 cases. So we have suggested that they suspend that small group activity. Now, the teacher's last day at the school was on the 6th of June. So for this school, in total, including the teacher, there are 14 cases. As for death cases, we don't have new death cases today. And for the variant strain BA 2.12.1, 120 cases are imported cases confirmed to be BA 2.12.1, and then there are 28 imported cases suspected to be BA 2.12.1. As for local cases, there are 2 local cases not related to other cases. One is a 57-year-old female living at Kong Fuk Road, Tai Po. She works at the VIP lounge at the airport. She works in the kitchen. She's a dishwasher. And she shouldn't have come into contact with others. It's possible that she was infected in the community. But then, as she also works at the airport, we don't rule out the possibility of her being infected by an imported case. And then another woman, 61-year-old, living at Shunhua House, Huoche, SA Shatin. We have not identified any other cases linked to this one. There are 2 new clusters. One on the 4th of June, from 9 p.m. to 2 a.m., Wyndham Street, Wyndham Lane. There's a place on the 2nd floor called West City. There's a place for people to drink, play billiards, or dance. So far, we have 18 cases, 9 male and 9 females, aged between 21 and 35. The first case was on the 6th of June. For some of these infected persons, they it's symptomatic. And out of these cases, for 5, we've had some preliminary genetic analysis. It seems that it's a local strain, is not a local variant strain. And then another cluster is in FLM, number 62 Soho, Java Street, Soho. That place operates from 11 p.m. to onwards. So far, there are 13 cases, 12 males and 1 female aged between 22 and 42. We understand there's a case. One of the cases went to Link on the 27th of May, and then on the 6th of June, that same case came to this place. So we need to wait for the genetic analysis to see if any cases are linked. But then for the samples we've got, we've done some initial genetic analysis. It seems that it's actually a local epidemiological strain. As for Shuffle, there are 5 more cases. So in total, 112 cases who are customers and 6 staff members infected. That's all from me. Dr. Lau Kah-hin, please. There are 373 patients in hospital. 57 are newly admitted patients. For patients that need to be isolated, 97 are in our isolation wards. 9 patients are in second-tier isolation wards, and 47 patients are in the North Lantau Hospital, Hong Kong Infection Control Center. In total, there are 36 new confirmed cases. Yesterday, there's no critical case reported, and there's a newly reported serious case. For patients in hospital, 12 are in critical condition, 7 in serious condition. 3 of the critical patients are in ICUs. Yesterday, there's no newly reported death cases. In the past day, 55 patients have recovered. 50 of them have been discharged. For the 5th wave of the epidemic so far, 50,804 patients have recovered, and 50,433 patients have been discharged. And since early 2020, 63,184 patients have recovered, and 62,810 patients have been discharged. And there's 1 patient that's found to be in confirmed case upon admission, screening, or testing, and 3 patients have been listed as close contacts. As for staff members, so far 23,651 patients have been infected. Of those, 23,569 of them have returned to work. Thank you. So the floor is open to questions. Please first raise your hands and use the microphone we give you to speak. Before you speak, please identify your organization and yourself. The first one over there, the gentleman. I'm from Hong Kong 01. Good afternoon. If I may clarify the figures on confirmed cases, because as you mentioned, Dr. Chuang, for both PCR and RAT positive cases, there are 360 respectively. But then in total, you say there are 851 cases. So have you read it out wrong? How did you arrive at this figure of 851? And if I could ask about the trend, 851 cases is a new high in recent weeks. So going by this trend, is it possible that we may see more than 1,000 cases each day, and will we see an exponential growth in the number of cases? So should we need to tighten any of the anti-epidemic measures? Now for the new bar clusters, there's mentioned that one of patients has been to Link. So would you think that's a linked case? Is there a chance that there's a spread of cases among the clusters? And then previously we've received complaint that some of the restaurants have been included, have been covered by the compulsory testing notices, but then they've not been informed by the government that they're subject to compulsory testing. They only found out from media report. How come this has happened? Do you think there could be any improvement, would you be giving them notice? Thank you.
There are 491 PCR confirmed tests. I just made a mistake just then. Just previously, there was a case who visited Link on the 4th of June and have also been to REST. We would do whole genome sequencing to see if there's link. You mentioned restaurants haven't been notified after they are put on the compulsory testing notices. And it may have to do with the BA.2.12.1 subvariant cases. We just want to see if there are other people who have also been to those restaurants, and then they will be required to undergo compulsory testing. Next question. The gentleman with glasses. Your media outlet, please. I'm from cable TV. And there are more teachers and students getting infected. What's the source of the infection at schools? What's the route of transmission according to the CHP? For the cases at schools, now there's a similar percentage of positive cases at schools as in the community, roughly at 0.01%. We're getting the impression there are more cases at schools because both teachers and students have to do daily rapid antigen tests. That's how cases get uncovered. There are more than 700,000 students and more than 100,000 teachers going to school every day, so that's more than 1 million people in total. We may get dozens or around 100 cases every day. The percentage is similar to the positive cases found in the community. As there are more positive cases in the community, you see more cases in schools. But you do see some clusters, so maybe 3 or more people or involving both teachers and students at the same class, each with different onset dates. Omicron being a highly infectious subvariant. Now, there was some infection transmission going on even when there was just exams. We are concerned about transmission at school, so when we have clusters, we recommend a suspension of classes. But for most schools, out of the hundreds of cases, maybe for 90 something of them, those schools involve just 1 or 2 cases, and there are no clusters at such schools. So these may be just cases from the community. Next question. For the school, 2 classes are involving students. 1 teacher teaches both classes. This teacher also teaches a math group. To play safe, we recommend class suspension for all 3 classes. Next question, the gentleman at the back. I'm from Now TV. For the 2 places with recent outbreaks, did all the customers put on masks when they visited the places? Have all these places been fully vaccinated and do they meet the vaccine pass requirements? We see more outbreaks at bars. Is there transmission chain at bars? Are there ways to break the transmission chain? Is there a need for bars to suspend operation? And how do you spell REST City? REST City. RECKSCITY. For the other place, it's FLM. People visit those places for drinks and have chats. Other people watch others play billiards or dance. Very often, they don't put on masks and they have chats with strangers. Transmission may happen in those places. For the FEHD, they have reminded the people there to stick to the latest requirements in areas such as ventilation requirements, so that hopefully the ventilation can be improved at bars to minimize transmission. Next question, we'll take an English question.
CMP, and As the caseload has further increased to over 800 cases today, how does the CHP evaluate the current pandemic risks? Should the public be worried about the situation? And also, the chief executive said she was worried that Hong Kong international status would be weakened if Hong Kong could not resume international traveling. So from an anti-epidemic perspective, do you think that after July the 1st, it would be an appropriate time to resume talks about opening borders with the mainland and loosening travel restriction? And the last question is, Professor David Hershey-Chen said maybe if the mainland authorities are still worried about Hong Kong's situation, Hong Kong's authority could consider a closed-loop mechanism to resume quarantine-free travel with the mainland. So do you agree with this suggestion? Thank you.
I think the number of cases, positive cases, has gradually increased during the past 1 or 2 weeks, from around 200 to 300 to around 600 to 800 at present. And also the other indicators, including the sewage and also the compulsory testing, etc., they have also slightly increased. This also include the R as estimated by the University of Hong Kong. But fortunately, we have not observed any increase so far in the admission figures as well as the number of serious or death cases at present. So we will closely monitor the situation to see whether there is any increase in the burden in the healthcare system. I won't comment on other aspects, including the political perspective.
我哋答埋最後一位嗰位女士。
The last question, the lady over there. I'm from Ming Pao. We see more cases today. For the CHP, what's your assessment for this increase in cases? Is there a rebound in the cases? And for the RT positive cases announced today, how many of them were previously unannounced? For the Layman Chang English Primary School, can we have a breakdown of the cases? The figures, we add up the figures and we arrive at 13 cases, so doesn't add up according to a figure. For those cases, for the BA.2.12.1 cases that have gone through whole genome sequencing, is the genome sequencing result the same for all these cases? Do they come from the same origin? For the different subvariant, the different mutant strains, the other mutant strains, can we have a breakdown? How many of them are imported cases and how many of them are local cases?
Oh, I omitted to mention one more case. Someone who had meal with a child of the mathematics class, so there's a close contact, and so that's why together 14 cases for Lam Chan English Primary School. Now for the 491 PCR positive or RAT cases, positive cases, they are all new cases, 491 new cases. So that's why in total 851 cases today. The other question, sorry, I didn't catch it. Can you repeat it? Sorry, speaker is not using microphone. BA 2.12.1. Well, it was the same source for the McDonald cluster and the other linked cases. We can see that it's the same source, but for the latest cases, we have to wait for the analysis. For the epidemic, you can see figures have been going up slightly, but then fortunately, in terms of serious cases, critical cases, or death cases, or hospitalization cases, we have not seen notable trend of increase. So we would appeal to the public to get the third dose if you haven't yet received the third dose of vaccine. Now, there have been transmission chains in the community all along. If there are more people, affected, especially, during weekends and long weekends, there are more gatherings of people. Maybe in the past, some people have never been infected or they've stayed home, but now they've come out. Of course, that would then lead to some more cases. Thank you. That's the end of the press briefing.
Oh, sorry, 12
Sorry, 12 males and 1 female.